So I would like to call upon the health experts and health professionals in Rwanda to really look into the connection between conflict and health and try to avoid or prevent conflict so that health outcomes are better. I would like the WHO, the World Health Organization, also to play its role in making conflict as one of the key components of what it does when it is caring, when it is itself becoming one of the biggest hospitals for the world, where we say the director of the WHO is the doctor of the world, right? Yeah, Muraho. My name is Mulugeta Gabriel Xavier. I am a professor and vice chair for global health at the Medical University of South Carolina. And by training, I am a biostatistician who does data sciences, and also I am a research health scientist who does translational health as well as global health. I am here from the United States, particularly from South Carolina, to attend the International AIDS Society annual conference in Kigali. And Kigali has been hospitable, welcome, but more importantly, very clean, spotless. So thank you so much for making it very, very hospitable. Originally I am from Ethiopia, from the Tigray region of Ethiopia. So I came here as an invited speaker to talk about double burden. Double burden means the burden of HIV/AIDS and conflict in areas which are prone to war, conflict, or some other forms of violence. The reason we would like to study this is that because any conflict is a huge risk factor in making healthcare availability bad or worse, or even sometimes impossible. It also leads to the destruction of health facilities, and it also leads to displacement of health workers. So when you combine all this together, you are creating an environment where people who would need healthcare, including people with HIV, or people who are just getting new HIV infections from knowing their status. So healthcare services become disrupted, and that disruption makes it really very bad for any nation, for any country, or for any people. So the goal is to make conflict a priority agenda in any public health study, in any public health program, in any public health initiatives. Thank you.
What's your expectation from this conference?
That is a good question. So there are, at least I can talk about a couple of them. One is, I hope this conference has created this reason where we have to champion one global funding for HIV research, for HIV discovery, or HIV/AIDS treatment discovery, and at the same time I am hopeful that the world recognize all the progress that has been made in caring for HIV, in doing research on HIV, in I think solving some of the difficult problems with regard to prevention of HIV infections, whether it is using PrEP, injectable drugs, or things like that. I think all that discovery doesn't need to stop because of lack of funding. So my hope is that the world will hear the scientists that are gathered here, the public health professionals that are gathered here, the clinicians that are gathered here, who are talking about making sure that research, the progress that has been made, continues, and there is money, there is funding to make that available. The second hopeful message that I have is our world right now is in a lot of conflict situations, whether you go to Gaza, whether you go to Ethiopia, the Sudan, the Congo, so many places have some form of conflicts. And these conflicts bring a situation where, one, health facilities are destroyed, two, people who do service or health services are displaced, and also people, the residents are displaced from their homes where they usually get care. So all this combined create a situation where, you know, people could be unhealthy, people don't have access to health care when they need it. So I would like, you know, the world to recognize, especially professional associations like the IAS, any world public health organizations and associations, to recognize that conflict in by itself is a risk factor. It is a priority agenda in public health and generally in health. So I would like the WHO, the World Health Organization, also to play its role in making conflict as one of the key components of what it does when it is caring, when it is itself becoming one of the biggest hospitals for the world, where we say the director of the WHO is the doctor of the world, right? So I am hopeful that WHO, and here in Rwanda also, which I totally appreciate the efforts of the government. I have heard the minister talk about what you are doing in Rwanda. So I would like to call upon you know, the health experts and health professionals in Rwanda to really look into the connection between conflict and health and try to avoid or prevent conflicts so that, you know, health outcomes are better. So really, these are two main messages that I am hoping you know, people would understand, will get out of this conference. Thank you so much. Murakoze.
So I think the challenges that we all face are substantial, but our knowledge and our toolkits are expanding, and the future holds great opportunities for the global scientific community to seize.
It's true that we have to consider the design, we have to consider what was the endpoint, we have to consider that we exclude those more severely suppressed, but I think that's the moment that scientific society think about the recommendation they find in guidance.
HIV and mental health. Now, mental health challenges are often unspoken, but their impact is profound. Emerging evidence shows strong correlations between depression, anxiety, trauma, and HIV outcomes. Despite advances in HIV prevention and treatment, mental health remains under-addressed, yet it directly affects medication adherence, retention in care, risk behaviors, and quality of life.
And that is to thank you all. We listened, we learned, and we took action. We've seen new evidence, new innovations, and new partnerships lightening the way ahead. And we have left the energy that will drive us forward. These all are testaments to the strength of our collective response. We also saw WHO releasing its guidelines on using lenacapavir for PrEP. This is a giant step. Thank you so much. Toward ending HIV as a threat to public health, but also access to the potential game-changing long-acting injectable is very critical. We also learned about the safety and efficacy of long-acting injectables for pregnant and lactating people and their infants. The impact, although, of the funding cuts and how countries and programs are adapting to the funding cuts, how technological innovations such as AI are improving healthcare delivery, including supporting HIV self-management, study results that can inform efforts to target and eliminate HIV harboring cells, and even much more.